Okay, today our viewer question is, what are your thoughts on oil pulling?
This is a very interesting practice, I believe, originated in the Indian subcontinent. And this is the practice of taking a mouthful of oil, a vegetable oil, it's usually safflower oil, sunflower oil, coconut oil, and using your cheek muscles and your lips to pull the oil in between your teeth, pull it into your mouth, and then push it out. It's all done with your mouth closed, but it goes in between your teeth, back and forth, out into your lip pouch there, and then you pull it back into your oral cavity, back and forth, back and forth. And in doing so, the hope is that you're doing good things for your teeth, your gums, and there's been all sorts of claims that it cures cancer and rheumatoid arthritis and all sorts of fantastical claims for it. There really is no evidence that it really has these wonderful systemic effects. Does it really help your teeth and your gums? There is some evidence that it can, if you do it on a regular basis, that it can reduce the amount of both gum disease as well as plaque formation on your teeth. But there's also a question whether it's really increasing the decay in your teeth. There are studies either way on that, but in my estimation, it shouldn't be done at all. Why? Because the other reports in the medical literature that really have me concerned, especially as an old anesthetist who cares about people aspirating things into their lungs. There's quite a number of reports of people doing the oil pulling, and what happens is a few drops of oil. If you're doing this day after day after day, one of these days, a few drops of oil may slither down the back of your throat and trip off the cough reflex, and people cough. They cough out, and then at the end of that cough, you've got to breathe in. And it's on that breathing in, if your mouth is full of coated with oil, that you breathe in a fine spray of coconut oil or safflower oil, and it goes down into your lungs. And oil in the lungs is not a good thing. You get a very dangerous condition called lipoid pneumonia. The oil goes all the way down to the air sacs, to the alveoli of the lung, and coats them there. Really can cause a very severe pneumonia. And if you do searches on oil pulling and lipoid pneumonia, you'll see that this aspiration concern is not academic. And so for that reason alone, no matter whether it may make your gums a little healthier, is far outweighed by the risk of aspiration. And nowadays, with today's good flosses and dental brushes and these water picks, you can do just a sterling job of keeping your gums and the spaces in between your teeth perfectly shiny and bright and healthy without having to resort to this ancient technique of oil pulling. So in the thumbs up, thumbs down land, when it comes to oil pulling, sounds exotic, but it gets a thumbs down from this doc here. Buy yourself a water pick and use it twice a day, especially after you eat dried fruits and things that might stick in between your teeth there. And if you do that, I think you'll have a healthy mouth without the risk of an aspiration lipoid pneumonia. Hi everyone, Dr. Michael Klaper here, announcing our new format for our Q&A with Dr. K. Annie Hagen will be asking me one question that's been sent in by our viewers. So if you want to see if your question is getting answered, do join us for our Q&A with Dr. K right here. Hope to see you then.